Asthma is a chronic respiratory condition characterized by inflammation and narrowing of the airways, resulting in recurrent episodes of wheezing, breathlessness, chest tightness, and coughing. It is triggered by various factors such as allergens, irritants, infections, exercise, and cold air. While it often starts in childhood, asthma can affect individuals of any age. Although there is no cure, asthma can be effectively managed with medications and lifestyle adjustments. Treatment typically involves the use of inhalers to control inflammation and open up the airways. People with asthma should work with healthcare providers to develop an asthma action plan, which outlines symptom management, medication usage, and when to seek emergency care. With proper management, most individuals with asthma can live active lives with minimal disruption from symptoms. Definition of asthma. According to the World Health Organization, WHO, asthma is defined as a chronic inflammatory respiratory disorder characterized by recurrent episodes of breathlessness and wheezing due to reversible airflow obstruction. The inflammation in the airways leads to increased sensitivity to various stimuli, such as allergens and irritants, causing the airways to narrow and resulting in symptoms like coughing, chest tightness, and shortness of breath. The WHO emphasizes that asthma is a significant public health problem affecting people of all ages, with a particular impact on children. It highlights the importance of proper diagnosis, appropriate management, and access to essential asthma medications to control symptoms and improve the quality of life for individuals with asthma. Furthermore, the WHO emphasizes the need for comprehensive asthma management strategies that include regular monitoring, patient education, environmental control measures, and the provision of essential asthma medications. By implementing these strategies, the aim is to reduce the burden of asthma and minimize the impact of this chronic condition on individuals and communities. 10 main causes of asthma in India. Equal sign. While asthma can have various causes, here are 10 main factors that can contribute to the development or exacerbation of asthma in the Indian population. Allergens. Common allergens such as dust mites, pollen, pet dander, and mold can trigger asthma symptoms in susceptible individuals. Air pollution. High levels of air pollution, including particulate matter, vehicle emissions, industrial pollutants, and indoor air pollution, can worsen asthma symptoms. Respiratory infections. Viral respiratory infections, particularly in childhood, can increase the risk of developing asthma or exacerbate existing asthma symptoms. Tobacco smoke. Both active smoking and exposure to secondhand smoke significantly increase the risk of developing asthma and can worsen symptoms in those already affected. Occupational exposures. Exposure to certain substances and irritants in the workplace, such as chemicals, dust, and fumes, can contribute to the development of occupational asthma. Genetic factors. Family history and genetic predisposition play a role in asthma development. If parents have asthma, children are more likely to develop it as well. Obesity. Being overweight or obese increases the risk of developing asthma and can worsen symptoms due to the inflammation caused by excess weight. Poor indoor ventilation. Inadequate ventilation in homes can lead to the accumulation of pollutants, allergens, and humidity, which can trigger or aggravate asthma symptoms. Socioeconomic factors. Lower socioeconomic status, inadequate access to health care, and suboptimal living conditions can contribute to a higher prevalence and poorer management of asthma. Stress and emotional factors. Psychological stress, anxiety, and emotional disturbances can influence asthma symptoms and trigger exacerbations. It is important to note that asthma triggers and causes can vary among individuals, and not all individuals with asthma will have the same triggers. Therefore, it is crucial for individuals with asthma to work with healthcare professionals to identify their specific triggers and develop personalized management strategies. Most signs and symptoms of asthma in India. Equal sign main signs and symptoms of asthma can vary from person to person, but commonly include wheezing, a whistling or high-pitched sound when breathing out, which is caused by narrowed airways. Shortness of breath, feeling breathless or having difficulty breathing, especially during physical activity or when exposed to triggers. Chest tightness, a sensation of tightness or pressure in the chest, often described as feeling like a heavy weight on the chest. Coughing, A persistent cough, particularly at night or early in the morning. The cough may worsen with exercise or exposure to irritants. Difficulty sleeping. Asthma symptoms can worsen at night, causing disrupted sleep or waking up feeling tired. Rapid breathing. Breathing faster than normal to try to compensate for the restricted airflow. Fatigue. Feeling tired or lacking energy due to the extra effort required to breathe properly. It is important to note that these symptoms can vary in intensity and frequency. Some individuals may experience mild and infrequent symptoms, while others may have more severe and persistent symptoms. Asthma symptoms can also worsen during asthma attacks or exacerbations, which can be triggered by allergens, respiratory infections, exercise, or other factors. If you experience any of these signs and symptoms, it is essential to seek medical attention for proper diagnosis and management of asthma. Pharmacological management of asthma =sign involves the use of medications to control symptoms, reduce inflammation, and improve lung function. Common medications include short-acting bronchodilators. These quick relief medications provide immediate relief during asthma attacks by relaxing the muscles around the airways, opening them up for better airflow. Long-acting bronchodilators. These medications provide long-term control of asthma symptoms by keeping the airways open for an extended period. They are often used in combination with inhaled corticosteroids. Inhaled corticosteroids. These anti-inflammatory medications reduce airway inflammation and help prevent asthma symptoms. They are used regularly to control and manage asthma in the long term. Combination inhalers. These inhalers contain both a long-acting bronchodilator and an inhaled corticosteroid, providing both symptom relief and anti-inflammatory action in a single device. Non-pharmacological management of asthma =sign involves various strategies to minimize triggers, improve overall lung health, and reduce the frequency and severity of asthma symptoms. Some non-pharmacological management approaches include identifying and avoiding triggers. This involves recognizing and avoiding allergens, irritants, and other factors that trigger asthma symptoms. Allergen control. Measures such as keeping the environment clean, reducing exposure to dust mites, pet dander, and mold, and using allergen-proof covers on bedding can help minimize exposure to allergens. Breathing exercises. Techniques like deep breathing exercises and diaphragmatic breathing can help improve lung function and reduce the intensity of asthma symptoms. Regular physical activity. Engaging in regular exercise and physical activity can help improve lung capacity and overall fitness, making it easier to manage asthma symptoms. Asthma action plan. Developing a personalized asthma action plan in consultation with a healthcare professional helps individuals understand and manage their symptoms effectively, including knowing when to adjust medications or seek medical assistance. It is important for individuals with asthma to work closely with their healthcare providers to develop an individualized treatment plan that includes both pharmacological and non-pharmacological management strategies based on their specific needs and triggers.